Have you been diagnosed with cataract, or do you know someone who has been diagnosed with cataract? Then this is the right video for you. In today's video, I am going to bust the 5 most common myths that are related to cataract and cataract surgery. If you guys want to know more about cataracts, how they develop, what are the risk factors for cataract, how do they affect the vision, what are the symptoms that a patient faces, then do check out my video on understanding cataracts, which I will link in the description. Hello everyone, I am Dr.PayalPandit, a board certified ophthalmologist and a cataract and refractive surgeon. And let's start ASAP with today's video. Do you really need to wait for the cataract to mature? So what exactly does it mean when your doctor says that your cataract is a mature cataract or an immature cataract? So let's understand that first. Now, a mature cataract is basically, it will appear like a white dot in the center of the pupil of the patient and block all the rays of light which are going into the eye. In that case, the patient can actually perceive only light and will not be able to see the face of a person standing right in front of him. So this is a mature cataract. Any stage which is below the mature cataract stage is called as an immature cataract. Now there are several complex grading systems which are there, which allows your doctor to grade the cataract according to the hardness or the density of that cataract. However, in order to explain it to the patient, what we like to tell them is what is the percentage of cataract which has developed. So we generally try to say that, you have 10% cataract, 20% cataract. If it is a mature cataract, it is 100% cataract. So it is something which is easy for the patient to understand. Now, even a 5% cataract can actually cause a decrease in the quality of vision if it is there in the center, and you will experience blooding, halos, and other symptoms of cataract. So, if you do have a cataract and it is affecting the quality of your life, there is absolutely no reason to wait for it to mature further. In fact, go ahead and get the surgery done at that stage. Also, one advantage of getting the cataract surgery done earlier is the fact that when we do surgery these days, we use ultrasound energy to break down the cataract. Now, obviously, the harder or denser the cataract, more energy is used. So, when you operate cataract, when your doctor operates cataract at an early stage, lesser amount of energy is used to break up the cataract and to emulsify it. So, you don't have to wait for your cataract to mature, and you can plan your cataract surgery according to your convenience. So a lot of patients do come with the question that we have heard that we need to get operated only during winter or when it is cold outside. Now, let me tell you why this myth has actually come. In the olden days, the type of cataract surgery that used to be done was called as ECCE, or extracapsular cataract extraction surgery, and even SICS, which is small incision cataract surgery. Now, both of these types of cataract surgery would require a incision which was almost 6 to 7 millimeters in length and would require stitches to be taken at the end of the surgery. Now, because of the larger incision size and because stitches were taken, the patients would be advised to avoid head baths or showers or for almost a month after the surgery. And especially in summer months in tropical countries, this was a very huge deterrent for the patient. Also, during summer months, there was that increased risk of sweating, which could lead to infection. However, in today's day and age, the type of surgery that we are doing is a phacoemulsification surgery where the incision size is less than 3 millimeters. It does not require any stitches, and the patients can take a head bath as early as within a week of the surgery. As a result of this, you can actually plan your surgery irrespective of whatever month it is or whatever season it is. So don't base your cataract surgery decision on the season, but rather on what is your doctor's recommendation and what is your requirement. Now, the need for spectacles or glasses after cataract surgery actually depends on the kind of lenses that you are choosing to be placed within your eye. Now, if a patient is going for monofocal lens during his cataract surgery, he will definitely need glasses for intermediate and near work. Similarly, a patient with a high cylinder power, if he does not go for a toric intraocular lens, then he will need glasses for distance, intermediate as well as near. Now, the most common type of lens which is recommended in case the patient does not want to wear any glasses is a multifocal or a trifocal lens. Now, these type of lenses are actually not suitable for all types of patients, so your doctor will actually get additional tests done to see if you are actually an eligible candidate for these lenses. Secondly, even after implanting these lenses, one should keep in mind that while these lenses provide freedom from glasses majority of the time, you might actually need glasses for certain type of fine work, especially if you are someone who is interested in needle work and that kind of thing, which is requiring a lot of fine detailing. Then you might require glasses even after these. So do discuss whatever your expectations are with your doctor prior to opting for a particular type of lens, because there are pros and cons of all of these lenses. If you guys want me to make a detailed video on the various types of lenses that are available for after cataract surgery, and if you want to know in detail about who is eligible for what type of lenses, then do let me know in the comment section below and I'll make a separate video about this. Now, another common myth that patients have is that the second eye cataract surgery needs to be done 5 to 7 months after the first eye surgery. This is actually not true. Unless it has been specified otherwise by your operating doctor, you can actually go for the second eye surgery as early as 5 days to 1 week. Now, the reason behind this, as I like to explain to my patients, is that whenever we are moving about in the world and we are looking at things, we are doing it with both eyes open. Now, suppose you have one operated eye and your second eye is not operated and has a cataract. Vision from that second eye, the non-operated cataractous eye, is going to be less as compared to the vision from the good eye. So when the vision, the clear vision from the good eye and the unclear vision from the non-operated eye basically reaches the brain will always prefer the clearer image. Now, what can happen is that the patients might start experiencing symptoms of eye strain, headache, watering from the operated eye because of the fact that only one eye is operated and one eye has clearer vision. The second thing that you should consider is the financial issue. Now, what happens is that when we get certain blood tests and other scans done, now these scans can be valid for a period of 1 month or 1.5 months. So, if at all the patient, also we prescribe glasses to the patient at the end of 1 month after the cataract surgery. Suppose a patient wants to go for cataract surgery for the second eye after, say, 6 months. All the blood tests, the scans have to be repeated for the patient. Secondly, whatever glasses that they got made after the first eye cataract surgery will now have to be changed because the number will change in the operated eye. So, unless your doctor is specifying it otherwise or there is no cataract in your second eye, it is actually advisable to go for the second eye surgery at the same time as your first eye, meaning within a gap of 5 to 7 days. A lot of patients actually come to me and tell me that please prescribe eye drops so that my cataract can be cured. Unfortunately, we don't have eye drops or any kind of medications which can reverse a cataract. A cataract is the cloudiness in the natural crystalline lens of the eye, which occurs as a result of the collection of fluid and other products within the lens, which is normally clear. And this is because of the failure of the pump mechanism of the lens. Now, this process by which the cataract lens has become cloudy, it cannot be reversed with eye drops or any type of medications. So, it is actually not advisable that you wait or try drops or other things after you have been diagnosed with cataract and advised surgery, because your cataract will progress and no doctor can actually tell you how soon your cataract will progress. So rather than waiting and allowing your cataract to become more denser or mature, it is actually important that you plan your cataract surgery. Like I always try to tell my patients, cataract surgery is an elective surgery. Please don't make it into an emergency surgery. So, this was my list of top 5 myths related to cataract surgery. I hope you guys enjoyed this video. Let me know in the comment section below which of these myths you knew were false. And please stay healthy, keep those eyes healthy, and I will see you all again very soon in the next video. Bye bye.